In this video, we will examine the use of chronomodulation during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. Chronomodulation is administering therapies at the time of day that is most biologically advantageous. Different biological processes, such as drug absorption, distribution, metabolism, and excretion, are all influenced by circadian rhythms, circa meaning about, DIA meaning day. Chronomodulation has been applied to a variety of cancer therapies, from chemotherapy to radiation, and has contributed to survival improvements of over 200% and 5-fold toxicity decreases. A recent meta-analysis of 18 studies involving 2547 patients found that 14 of the 18 studies reported differences in toxicity of therapies based on time administered. The majority show reduction in toxicities, but 2 of the 18 studies showed chronomodulation reduced some toxic effects and increased others, while 1 study reported chronomodulated chemotherapy produced worse toxicity outcomes than standard chemotherapy. 3 studies reported an increase in the efficacy, such as survival measures and tumor response rate, of chronomodulated chemotherapy, while none reported a decrease. It is very difficult to generalize what time of day is the best to administer a therapy unless there has been a study specifically testing it. For instance, sex of the patient, stage of the cancer, and type of treatment being administered all influence the effects of chronomodulation. One therapy type where it may be possible to make the broadest of generalizations is immunotherapy. It seems like immune checkpoint inhibitors, ICIs, may be best if administered before noon. One study of 481 melanoma patients, 299 of whom had stage IV, showed that ICI administration before noon conferred a significant survival advantage compared to afternoon. Another study of 95 stage IV NSCLC patients revealed that patients receiving their ICI infusions between 9:27 a.m. and 12:54 p.m. had a median progression-free and overall survival of 11.3 months and 34.2 months, respectively, while the group that had their infusions between 12:54 p.m. and 5:14 p.m. had a progression-free and overall survival of 3.1 months and 9.6 months, respectively. In fact, any cancer therapy relying on the immune system may be best administered in the morning. Counts of circulating lymphocytes and immune cell are nearly twice as high in healthy volunteers at 8 a.m. as they are at 4 p.m. or midnight. Having an abundance of immune cells in circulation at the time immune-modulating therapies are administered seems to be beneficial. The Bacillus Calmette-Guérin (BCG) vaccine, frequently used in bladder cancer, has also been found to be most effective when administered before noon rather than after. More information about chronomodulation during cancer treatment can be found in the book Cancer Self-Defense 101, Quick Tips to Help You Survive.